This is Fox 26 Morning News at 8 a.m.
Macular degeneration is the leading cause of vision loss. While treatment is available for the wet form of macular degeneration, there hasn't been a way to help the dry version until now. An implantable miniature telescope goes into the eye at the time of cataract surgery. Edward Leps is one of the first patients to undergo the procedure.
I could read, but in time the reading was going, and I guess about 6 months ago the numbers started fading. And being in the parts business, you always have numbers. So you can forget if you don't have the numbers, you're up a creek.
That's why he wanted this procedure so badly. He wanted to be able to see again. Well, Edward is now in the healing process and learning how to tell his brain to work that device. I'll introduce you to his story in our next hour at 9:30, and you'll hear more about how he's doing now. And one of the first specialists to offer this is Dr. Rahul Pandit with Houston Methodist Hospital, joining me now to talk more about this very promising procedure. Good morning to you. Thanks for taking time away from the hospital to be with us today.
Good morning, Melissa. Thanks for having me.
This sounds like a huge deal. My grandmother had macular degeneration, and I just remember how difficult it was for her. They have this big blob almost in front of their eyes, so they can't see. They can only see out of their peripheral vision, can't they?
Yeah, it affects your central vision, which, of course, covers pretty much everything we do, from reading to driving to just even getting around.
So quality of life, once you have this, has been kaput, basically. I mean, it's no life. It's very difficult for them.
Yeah, and we just don't have any treatment for it. Once you lose the retina, you can't get it back.
But now there is this tiny little telescope that you are using. Tell me more about that and what a huge advancement this is.
So it's a fascinating device. The fact that you can get a telescope into a small enough device to put in the eye is amazing. And what it does is it magnifies the image that patients are seeing, so it actually makes the image of what they're trying to see bigger than their blind spot, so they can see it.
Now, when I first saw this telescope, when you showed it to me and put it in the palm of my hand, I thought, ouch, that hurts. I wear contacts, and I know if you have an eyelash in your eye, it hurts. You surgically put this in, and the amazing thing is they can't even feel that it's there. Once those stitches heal, they never feel it. It's incredible.
Correct. The device is small enough to fit compactly in the eye, larger than a normal intraocular lens that we use after cataract surgery, but still very comfortable and doesn't cause any pain.
Okay, so I know a lot of people right now are saying, oh my goodness, my parents, my grandparents have macular degeneration. Are they able to get this treatment? Who qualifies for this? Because we're talking end stage, not the beginning stages of it, right?
Correct. So you have to have bad macular degeneration, and essentially you have to be legally blind. You can't see the big E on the eye chart, so to speak. And once you have that much severe vision loss in both eyes and you have a cataract, at the time of cataract surgery you can be eligible for the implantation of this lens.
And it just goes in one eye because you need that other eye to be able to see out of the sights?
Correct. You're absolutely right. One eye will be able to see the details that you were missing. The other eye will give you the peripheral vision to get around.
Now, some people may say, oh my goodness, it sounds like an expensive procedure. How about insurance on this?
The beautiful thing is insurance covers it. It used to be only eligible for patients above a certain age. Now, essentially, anyone over 65 can be eligible for it, and that's generally the population that's affected this severely by end-stage macular degeneration.
Now, you have been doing some injections in the eye that help one form of it, but it just only helped that one form. So do you think this is one of the biggest advancements you've seen for a while to treat this problem?
I think it is, and retina specialists have had injections to treat wet macular degeneration. What they haven't had is a way to correct people's vision who've lost it, even in spite of the advances in the injections therapy.
So this is going to be something that will make a big difference in their lives. It doesn't just give you instant vision, though. You do have to work on it, right? You have to go to occupational therapy and basically kind of train it and train yourself how to use that telescope.
Absolutely. There's a whole team that's created by the company that produces this telescopic lens. And the team includes occupational therapists, vision therapy optometrists, as well as retina specialists who identify the patients to send to us as well.
You get your whole team to help you get your eyesight back.
That's
Dr.
right.
Pandit, thanks for coming in from Houston Methodist Hospital. It's incredible to see what you're doing there, and I'm so happy to be able to follow one of your patients.
Thanks again for having me, Melissa.
All right. Well, again, show you that patient in the next hour. Jose?